Hi, welcome back. I'm Dr. Adam Rosen. Today I want to talk to you about a really simple tool that most people probably are not aware of. So, three common questions that a lot of people have is, well, how will I feel after a knee replacement? Like, what sort of improvement might I have? What's the chance of a revision in my lifetime? And what's the chance that I could die from this operation? So, there are three very good questions. This was a tool that came out in 2019 out of Sheffield in the United Kingdom. It was hosted by Professor Mark Wilkinson, along with a few other doctors from both Sheffield and Bristol. And they looked at 1 million patients that they had in their registry to calculate out what the outcomes might be to give you some information as to what are the answers for you for that question. So first, if you go to this tool, and I'll put the link in the show notes, so you can click on that to get to the tool, it's going to ask you some basic information, some demographic information. It's going to ask you your sex, your age, your height, your weight, and just a general health assessment of what's your overall general health. The second thing the tool is going to ask is either one, are you having a knee operation, or two, are you having a hip operation? If you click on the knee operation, it's going to ask you another series of questions about whether or not you're going to have a total knee replacement or a partial knee replacement, or maybe you're unsure. You can click that too. The next set of questions are going to ask you your quality of life. And this asks you a number of questions that help us answer the number or numerical value of what's called your Oxford knee score, which gives you sort of an assessment of pain and function. And there's a number of knee scores that are out there that people can use, and this is one of them. And then after you've answered all of these questions, it's going to spit out your results. So what I've done here is I've just answered the questions for your sort of average person undergoing a knee replacement, average age of 67, mildly overweight, and sort of mild to moderate answers for most of these questions. So here, the first response that you get is the pain score. It's going to give you pain and function score based on these Oxford knee scores. It's going to give you the number of what it predicts you are now as far as your function scale and what your recovery function scale might be. The next tab that you're going to click on is going to give you your chance or need for a reoperation or revision. And then the third window that you'll click over is going to give you your risk of death. So a very incredible tool, a very simple tool for you to use. I'm sure it was very complicated for them to put together and make. But when patients like you ask, what are the answers to those three questions? Improvements in pain and function, risk of revision, and risk of death. Here is a simple tool that you can do right now. Should only take you a few minutes, and it's going to give you the answers to those questions. So if you weren't aware of it, please check this tool out. I hope you enjoy it, and I hope it gives you some answers to the questions that you've been having. And again, if you haven't yet subscribed, subscribe below. If you like what you're hearing, click the thumbs up button below, and you can also click the little bell button as well. It will alert you when my new videos come up in the future. So until next time, stay safe, keep active. Thanks for listening. I'm Adam Rosen.